Caley Anderson from Collaborative Drug Discovery here in the Bullpen during Bio Week with Linda Tempelman from Persista Bio. Linda, tell me a little bit about yourself.
Yeah, thank you for having me on. So basically, I am a PhD chemical engineer by training. I've always worked in the bio space. And for many years, I worked at an R&D company developing brand new technologies. But in these last 10 years, I've been working on more entrepreneurial enterprises. So this is the second company I've been involved with as CEO or CSO. And Persista Bio is just a dream of ours to get one of the technologies that I'm an inventor on into the market.
Oh, that's wonderful. So Persista Bio, you just went through the Bullpen's Moneyball program. Let's get a little deeper on that and tell us, what you're working on at Persista.
Yeah, so Persista Bio is working on cell therapies for type 1 diabetes. There's a number of companies that are working on stem cells for type 1 diabetes, but the field that's been neglected is how you hold those cells and keep them healthy in the body. So we're working on an encapsulation system that holds the cells tight, protects them from the immune system, and we're giving them oxygenation. So it's kind of an engineering solution to a biologic problem. We can't let the blood vessels in because the blood vessels would damage the cells, right? The cells would get rejected by the body because they're from another human being. They're of another origin. And so we put the oxygen in so you can have a nice, tight, compact capsule, and the cells can grow in that space, that they can perform their function.
That's fascinating. So what stage are you in a part of this process?
Yeah, so we're in the preclinical stage. I'm licensing technology from my former company, Giener Inc., and I've already licensed technology from Cornell. And those two groups, we worked together during the pandemic and did some demonstrations together showing that this worked in a small animal model. And we've just had a preprint come out on our small animal data. And right now the fundraise for our company is to go into the large animal model and show things are working there, and also to start GMP manufacturing the components of the implantable system.
How much are you looking to raise?
We are looking for a $3.5 million 2-year raise, so we'll use those funds over 2 years. And my backup plan is I also have 2 NIH grants that are in and have gotten good scores, and one is listed as pending, and one they're making a decision on this week. So we're hoping to also get some grant funding. I will continue the seed raise, and then we will advance the technology further. So we'll take the physical components of the system and manufacture them and advance that part. So we want to be ready to partner with these stem cell companies that are going to need our help to make their stem cells last in the body long term and treat type 1 diabetics.
I love that, and I love the backup plan. So,
yeah,
with the Bullpen, our mantra is to find someone to help and repeat. What would be your ask of the Bullpen? How can we help you?
Sure, I'm looking for introductions to investors, and I've got a great coaching team. Stella Vanook and Tim Glennon and others are helping us, so they're making personal introductions to me to their network. I'm also interested in talking to people that have stem cells for other indications. So maybe very early stage work where people are trying to secrete a really cool molecule that the body needs, like something for pain control or an anti-inflammatory drug. And I'm interested in partnering with people that haven't thought about how they're going to keep those cells in the body long-term for a long-term cell therapy. I think cell therapy is changing. Cell therapy in the past is known for CAR T therapies, which are short-term treatments for cancer. Those cells are autologous. They come from your own body. They're modified to attack your body or attack the cancer in your body. But long-term chronic disease treatment is a different field, and we think we have a platform technology that will allow people to put any types of cells in the body to replace something that you're missing. Say you're born without a metabolic enzyme to do something, and you have to take injections or pills every day to help you do those digestions. We'd like to, anything that needs a shot now, we'd like to have a cell implant long term. Put it in there so you don't have to think about it. So I'm looking for cell partners, and I'm looking for investors and people that are interested in the type 1 diabetes application.
All right, Bullpen, you heard her. Now let's find a way to help Linda Tempelman with Persista Bio and bring her your resources.
Yeah, thank you.
Yeah, thanks, Linda, for talking to me today, and thanks for being here and going through Moneyball.
Excellent, thank you.